For patients who have EGFR mutations and are progressing on erlotinib, I will always try to obtain a repeat biopsy for a few reasons. I should say I will always try to, as long as it's safe to repeat that. Sometimes there's not a good place to biopsy, or there's something about the location or the patient that it makes it unsafe. But as long as it's safe to repeat the biopsy, I will always try to with patients progressing on erlotinib. The main reason for that is that a subset of those patients have transformation from non-small cell lung cancer to small cell lung cancer. And that's a really important distinction to make, because patients with small cell lung cancer can have a very good benefit from specific chemotherapies that we wouldn't necessarily think of using in patients with non-small cell lung cancer. And that's really important to know. So for that reason alone, I think repeating a biopsy on patients with EGFR mutations who are progressing on erlotinib is important. And then even beyond that, when you think about clinical trials for patients with EGFR mutations who are progressing on erlotinib, there may be some reasons to think that certain alterations in the cancer that are present at progression on erlotinib may make one trial treatment more appealing than others. And so when I think about clinical trials for patients, it is very helpful to know which resistance mutation that patient may or may not have to really try to steer them in the appropriate direction. It is also, at Yale and many other places, a really important research question to try to figure out what is happening when patients who previously have done so well on these targeted therapies are progressing, what is happening in the cancer, and what that means for different treatment options. For patients who are progressing on crizotinib, I think that question is a little bit different, because we haven't seen something like small cell develop. And so I think that is less concerning clinically, may help guide us in terms of trials, and definitely would help us understand what is happening at progression. But clinically, I think it's less clear that a repeat biopsy is really necessary at progression on crizotinib.